So you are big on technology in your practice, and you say that's one of the reasons why in implant dentistry you're able to do things very quickly and getting it right on the first time. Elaborate on that.
Yeah, we've streamlined the whole process of going from initial consultation to surgery and the follow-up in our office. And we utilize technology for that.
Okay.
So the first thing is we do a three-dimensional X-ray, a cone beam CT. And that allows us to see everything in 3 dimensions. So we're not going into the surgery blindfolded. We know exactly what to expect with the bone once we actually open things up for the surgical procedure. And many of my colleagues don't use this step because we need to see what we're doing before we actually do it.
Okay.
And the next thing that we utilize is computer technology. So I plan every single implant before I place it in a person's mouth. And so I've seen what could go right, could go wrong with a specific implant before we even touch the patient's mouth.
Okay.
And so that decreases the number of complications as well as makes the procedure faster so the recovery is faster for the patient. The newest thing that we're using is navigation surgery. So where I'm using a patient's 3-dimensional scan and in real time during the surgery, it's telling me exactly where to place the drill, where it needs to be for that specific implant. It's revolutionary.
Wow.
And it's making the surgeries faster and better, and it's getting things done correctly the first time around, rather than having to redo things.
Now you have you use digital printers to make guides. What is that?
So a digital printer allows me to print out a person's jaw, as well as a surgical guide to be placed on that jaw and in the surgery to make sure that the implant goes exactly where it should. We're all about 3D now, and if I can hold a patient's jaw in my hand and know exactly what the contours are before I go into the surgery, I'm that much better prepared to do the surgery. And I can do the surgery better and faster.
So you think it's less downtime, obviously, when you're more precise?
Absolutely. I mean, if I can do the surgery in less time and more accurately the first time around, it's going to be better for the patient in terms of the recovery, as well as the amount of pain that they're going to experience later on.